Good evening.
Hi. I'm sorry my headphones are giving me grief, but anyway.
I'm glad I can hear you, I can see you. Is it the same for
Great.
you? Yeah,
Yes,
super.
yes, yes, perfect.
So, a warm welcome to Kris and to all our viewers. Today, the 10th of October, marks World Mental Health Day. The theme for this year, Mental Health in an Unequal World, aims to highlight that access to mental health remains unequal. Connecting Trust welcomes Kris Chudawala, who is a trained peer supporter. Their work revolves around trans rights activism and mental health advocacy. Today, we would like to raise awareness about gender inequality and mental health. Hi, Kris. Thank you so much for
Hi.
joining us and talking to us today.
Absolutely.
To begin with, may I invite you to please share your perspective on mental health among the LGBTQ community?
Absolutely. Um, Thank you for having me here. Um, with the thing with perspective and mental health generally is that when we think about mental health, the easiest thing that we think about, like most people think about, is like depression or anxiety or things like that, right? Um, and this is not like these are not things that are specific to communities or specific to identities. This is anyone and everyone, right? However, it's often causes to things, it's causes, it's triggers, it's how things come to be is where we start discussion on, um, you know, the background that people come from, to put it in a simple way. Um, Essentially, because so I can like make this simpler to understand from an anecdote where um, I was someone who was going to a therapist for a long time for things like anxiety and things like that. Uh, However, it took me and the therapist both, who is not aware of it at the same time, to understand how much my idea of self, right? That is what I'm talking about when I talk about gender. My idea of self, or my idea of the world with regards to gender, sexuality, my role in society affects how much that affects my mental health, how much that affects. Um, Basically, these are things that would, um, there is a textbook way of seeing mental health, and that these are things that deviate my experience from it. So that is where we talk about marginalized identities and communities and mental health, because be it a person of a gender minority, be it any LGBTQI person, or any Dalit Bhujan person, or any marginalized person in general, your experiences of trauma, your experiences of violence, your experiences your, how do I say this? Your particular experiences within that marginalized identity affect your mental health. Um, Society in general affects your mental health, and so that is the main perspective when we talk about inequality and mental health, right? That is how I see it, if that makes sense.
Thank you, Chris. It does. Taking up or picking on the word of marginalized, can we also look at, and in sync with the theme for this year, the inequality in access to mental health among the community?
Absolutely. So as I said earlier, s- for the longest time, like when you talk about LGBTQIA community in India and our legality as such, the Nalsa judgment that recognized trans people came in 2015, 2015-16. The 377 was read down in 2018, and you're gradually seeing some form of mainstream acknowledgement of our existence, right? In an environment like that, what breeds to the maximum is misinformation, um, and it's clearly not true. It's just misinformation, to say the best. But it also is ingrained in medical sciences. Just a few days ago, Madras High Court, for example, actually put a judgment out there that says that medical books and how LGBTQI people are referred in medicine needs to be changed. This just happened a few days ago was a judgment by Madras High Court. That's just an example, but this is very real. You still have textbooks today that are medical, whether that be with regards to psychology or things like that, where where being queer is referred to as a disorder or as like a mental health issue, and that has been there for a long period of time. It's been very recently in the last. So internationally, it was recognized that it's not a mental health issue, that being transgender is not a mental health thing, say 10, 20 years ago. But its recognition in India is very recent. It's 5 to 10 years in India. So that is the reason I'm explaining this, is that is the root cause of lack of access, right? Because whenever I am looking for a mental health resource, I need to make sure that this resource is going to be for queer affirmative, it is going to be gender affirmative, as a marginalized person, that they're trauma informed, that they understand the importance that my past life trauma or my experiences as a marginalized person in society affects my mental health. I need a professional that understands that. And we don't have much of that, because the kind of training processes that exist, whether it be that your BA, MA, MPhils in psychology in India, in the way it's taught, these are things that are not given importance, or they're not. We're still following that very clinical approach, and it's not just India; it's all over the world. But India is like, especially, we've just seen any growth in the last 5 to 10 years. So the main reason behind lack of resources has been this, that we do not find enough mental health professionals or any other resources that center this idea that yes, my identity is central and that affects every part of my mental health, right? And it's also important as queer persons, as marginalized persons, for us to understand that it is this, me being queer, me being gender non-conforming, me being trans, is me as total. It's not something I can put aside, right? I know being closeted can give me grief, can give me anxiety, but it is me, it is who I am. And that self-acceptance takes you forward in that journey of better mental health.
Picking up on something you had mentioned earlier, combining two things, the lack of awareness among the general population, and also certain stereotypes about the community.
Yeah.
Would it be okay to explore a few problems that the community faces when it comes to gender identity for themselves?
Yeah, of course. Most importantly, like there is like rampant phobia. Hello. Yeah. There's rampant transphobia in India. Like, not that's like without any doubt, right? You see it in how media represents it. You see it in films. Bollywood has been horrible, to say the least. And it's vice versa, right? It exists in society. People exclude trans people. It's either we can curse you or we have to be outcasted. There is no midway. There is no leave us alone to exist. That is not there, right? So that is there in people, but that comes from misinformation, right? And at this, they do not know better. But then you have media, you have things like that reinforce the same thing. So that with that, we have a very negative understanding of what a transgender person is. In this patriarchal society, we generally have people being violent towards femininity. So men who are feminine, but even if they're cisgender, if it's a feminine person, you see violence. A trans person, you see violence. So violence is one. But even when it is not outright violence, even within schools or corporate spaces, where it's not outright violence, but it is the smaller things. And this is where mental health actually comes in, because it's things like misgendering. I am a person who is out, right? I'm not closeted, I am out. And I can say, hi, my name is Kris, and my pronouns are they and he. And pronouns is something so similar. It's like with pronouns, when I call you she, I recognize the fact that this is your name and this is who you identify as, this is who you are. When you deny someone something as basic as their pronouns, you are outrightly telling them that I don't care who you are. I am going out of my way to insult you. I'm going out of my way to disregard who you are, which is so subtle, which is so simple. Like something like pronouns is so simple, but that's still so much violence, right? With misgendering, obviously dead naming, right? This is specifically to trans people and gender non-conforming people, where if with regards to the gender I identify with, I have taken the name of Kris. I identify as Kris. If you are someone who does know my birth name or something, using that, even if though you know better, is again an act of violence. And that happens a lot with, we've heard a lot of this happening with corporate spaces, because for example, a trans person hasn't changed their legal name, because changing your legal name is a very tough process. So maybe the HR or your boss or someone knows what your dead name is because that's on your legal documents. Going out of your way to then use that and making your employee uncomfortable, making your colleagues uncomfortable, it's violence. So these are more minute things. Other than that, access to spaces, right? And this is workspaces, study spaces, public spaces in general. We've been calling for access to gender neutral spaces for a very long time. This is something a lot of people would have heard by now.
Could you give a little more clarity on what that means? Yeah, gender neutral spaces?
So basically, each and every public space is generally divided with men and women, like male and female, washrooms, changing rooms, train compartments, everything is gendered and divided into the gender binary. What that does is, people who do not fall into that specific gender binary, they face violence. And it's to the point where it's not even just trans people, and which is why we ask for a gender neutral space, right? It's not just trans people who face violence, that if a trans woman enters a women's compartment, she'll face violence. It's not just that. It's if it is a cisgender woman, but she does not conform to what the society says a woman should be. If she has shorter hair, if she talks a certain way, if she dresses a certain way, and she'll still face violence, right? So that's the reason for gender neutral space, a space where we do not allow the violences of the gender binary, right? A gender neutral space is a space where you let people use a washroom without having to answer to a million questions about who you are and what is your genitalia and what are you wearing, and doesn't matter. A person wants to go and use a washroom and leave. So with regards to public spaces, obviously, so this is something, the reason I'm mentioning these 2-3 things is because it is, how do I say this? These are very specific to mental health, because these are not outright violence, right? Because this is not someone coming and beating me up. These are verbal things, or this is lack of access to spaces. And these are discriminatory in nature. Constant experience of discrimination in this form is obviously going to affect someone's mental health. That's the whole point of it. It is trauma. It is affecting mental health. That is why that's where I'm kind of connecting that.
Continuing with the direction that this conversation is heading in, could we explore a little bit about mental health advocacy that is currently being practiced in India? or that we're looking at in India?
Can you just give me 1 second? I'm so sorry. I know.
I heard the doorbell. That's okay.
Yeah. Really sorry about that.
Thank you.
Yeah. So I was saying was that with regards, mental health advocacy. The reason why I specifically talk about mental health advocacy is right. Though I would say at any given point, you should definitely listen to a mental health professional. I'm not a mental health professional. I am a trained peer supporter, but I'm not a mental health professional. I dropped my psychology course after my second year in bachelor's. I'm not trained. I'm not a trained psychologist. But the point is, and at the end of the day, of course, when you talk about psychology, when you talk about mental health disorders, when you talk about things like that, mental health professionals who are trained, who have a degree, are the experts at this. I don't know. But the reason I talk about advocacy is especially with marginalized identities, self-advocacy is really important.
Okay.
1 second. 1 second. I'm so sorry about this. Yeah. I'm so sorry about this.
Self-advocacy.
Basically, self-advocacy is really important, essentially, because as I was mentioning earlier, right? How do I say this? Yeah. As I was mentioning earlier, you don't have, with regards to education, the way psychology education is, we do not have queer affirmative education, trauma-informed education already prescribed within the processes of psychology. Even the 4 years that I learned psychology before I dropped it, I know I have never read about, the maximum I read about gender was difference with the definitions, difference between gender and sex is all that I have read about in the 4 years I did psychology. That's all. That is where we live in. That's the world we live in. And the idea that, and what happens with psychology in specific is that it's very individualistic. It's like you are going to the therapist, so what are things you can do? There's no acknowledgement of the fact that yes, you come from a socio-cultural background where in the society we live in, you are experiencing a lot of violence. So this trauma is affecting you. It's not always your fault, is it? But there's a very individual aspect to psychology, the way it's taught. Of course, we are now seeing a lot of mental health professionals who are talking with themselves, talking about it. A lot of queer mental health professionals. There are a lot of other marginalized identities, mental health professionals from there. You have so what happens is they are actually now talking about it. They are bringing up courses where these things are taught to other mental health professionals. But that's where I come back to self-advocacy. When I mean is, I know my mental health the best is, I don't know how is that's an appropriate thing to say, but it's the way you talk about health, right? Like I know my body the best, I know my mind the best, and self-advocacy in general is often, how do I'm looking at the right word. Advocacy is like the patient or the person's advocacy. It's the person's right to make sure that their concerns are addressed properly, their experiences are addressed, are put forth properly, that they're not gaslighted, that their concerns are addressed, as I said earlier. That is what advocacy is. And especially when we talk about inequality and mental health, when you have a psychology and mental health industry and a world which is individualistic, which does not address trauma, which does not address marginalized identities, it is people who are from these communities who often have to advocate that, trauma informed, it needs to be trauma informed, it needs to be queer affirmative, it needs to be gender affirmative, things like that. So that's what I mean when it comes to advocacy and mental health. I hope this clarifies.
It does. Thank you so much for that. Because there are, from what you've shared just now, it's obvious that there has been this effort to not include, so the effort to exclude an entire population from the education system, whereby then when you become a healthcare provider, you don't even know that a percentage of the population is going through so much. So when they turn up at your service, then you are clueless, and then you're going to gaslight them and negate their experiences simply because you don't know.
Exactly. You do
And
not know better.
you don't
It's
know.
also you need to understand that when you look at psychological concepts, when you study these things, this is a lot of it comes from. You also need to see where this was researched. Right, there is context to that. It's in Western universities, done by mostly white people, coming from a perspective of a cisgender, heterosexual white person. Especially a lot of the older theories, a lot of the older research before 2000s, especially a lot of it is still used, and when you read through these studies, all your participants are say American cisgender heterosexual white men, and here you are sitting in a office in Mumbai talking to a queer brown person using that ideology and theory. It does not make sense. It's just out of context, which is why it's important, because it's just how colonial a lot of our education and especially medicine is, right? Medicine and health and everything. So that's why I think that's is what is the issue.
I once heard a statement while I was pursuing my mental health education, where the person who was teaching us very casually mentioned, oh, these people, we don't even know where they exist, so how are we going to do research on them? So it is very conveniently putting the blame on the members of the community for not revealing their identity and hence not giving access to research. And I found that very damaging.
Yeah, that's quite a savior complex, to be honest, isn't it? Because yeah, because I don't know how else to put it across. Because yeah, when you if you want to call out queer and trans people a minority in regards to numbers, yeah, fine, I can still understand. But if you're talking about marginalized people in general, worldwide, there are more brown and black people than white. If you're talking within India, there are more population-wise. We have like oppressor caste, upper caste people are a smaller population, literal population-wise. So it does not make sense. It's just how education systems, how these systems come to be and have been existing for a very long period of time. Again, coming back to advocacy, that's the point, right? We're trying to break that hegemony. We're trying to understand what we've missed for such a long time. That's the point of inequality as well. If queer and trans people for the longest time have been seen as mentally ill. Like, for example, dysphoria is the idea of gender dysphoria is still part of the DSM-5, but now it's however, it used to be, I remember a few decades ago, it used to be transgenderism, and that's horrifying. That's horrifying. In a lot of medical textbooks, even today, lesbians are addressed as tribalism. These are very offensive, queerphobic and transphobic terms that are taught to mental health professionals, that are taught to health professionals. So these are systems that come to be. This is where advocacy comes in. This is where we're talking about queer affirmative or trauma informed or things like that, where we're trying to change the system. And this is through lived experiences. Here I am sharing this with you. And mental health professionals of that marginalized identity also exist. So they are also trying their, how do I say this? They're trying to do their part by, starting programs, writing about their experiences and things like that. Hopefully we change something.
Since we're talking about mental health and the scantiness of services available, would you be able to share with us services that are community friendly,
Yeah,
accessible?
definitely. Like two things I can think of the top of my mind is for sure. So the program that I am part of, so this is a program by Safe Access, and basically they've trained about 30 peer supporters. So we are queer and trans people from the community. We are not mental health professionals, but we've 6 months and all training where we'll hear, basically providing a listening ear to people, and any questions that a person has with regards to gender, sexuality, and things like that. We have a listening ear. We can talk to you about it. So that is one program that I think is very beneficial, which I am a part of as well. So that's the community well-being program, the peer supporter program by Safe Access. And other than that, if any queer trans person is looking for a mental health professional, like to seek therapy or for anything else, there is you can always look for a QACP trained professional. So that's a queer affirmative professional, because there are trainings that exist called the queer affirmative counseling practice, right? This is by Mariwala Health. So you can look for a mental health professional who's been trained under that, who is queer affirmative, who's trauma informed, queer affirmative. And this is surely something that the said mental health professional would advertise. So, when you're looking for resources, this is what you can look for. That would be a great starting point for you to go
Reach out.
about finding what is right. Yeah, would you reach out? Yeah.
For our viewers, the information that Kris just shared, we would be sharing the details in the caption below the video once we put it on Instagram. You will also find these details on our other social media pages. So please do have a look so that you can use it, share it with anybody else who would require it. From Connecting Trust, if there is ever a point where you need someone to talk to, our distress helplines are available. They're open 12 to 8 every single day. And so is our distress email service. Please write to us. You will receive a response. We also have the Suicide Survivor Support Program, details of which will also be on our social media sites. Kris, thank you so much for being with us.
Thank you so much for having me. Thank you so much. And y'all are doing, I just heard that while you were sharing the services that you have, y'all are doing a really amazing job. And thank you for having me here.
Stay safe, Kris. And to all our viewers, we hope to see you soon. Bye-bye. Thank you.